Hello, everyone, and welcome to our webinar today where we're going to explore ScreenU, our web-based screening, brief intervention, and referral to treatment tool that was developed here at the Higher Education Center. I'm Cindy Clouner. I'm the Managing Director here at the Higher Ed Center. I'm one of your presenters today, and I'm joined by my colleague, Logan Davis, who will introduce himself here in a little bit. And we're really excited to share more about ScreenU and also just SBIRT in general, because the center really believes in the benefits of SBIRT on college campuses, whether that's happening with traditional SBIRT that happens in person or using a web-based tool like our ScreenU program. And so today we're going to explore both of them for you. Before we get started, I do want to go over a couple of housekeeping things. We certainly welcome your questions, and so if you have any, we encourage you to enter them into the question box in the control panel on the right-hand side, and Logan and I will be happy to answer those for you at the end of our webinar today. So before we really kick it off, I just want to go over what we'll discuss today, what our objectives are. And so as I mentioned, we're not just going to talk about ScreenU, but we're going to talk about SBIRT in its traditional sense as well, and give you a sense of the benefits of SBIRT on college campuses. Then we're going to transition into sharing a little bit more about ScreenU and walk you through the experiences from both the student perspective and the staff perspective of ScreenU. And finally, I'm really excited today to share for the first time some data that we've collected around how campuses are implementing the program and give you a better sense of some of the things that we learned from a study that we did this past fall on where and how campuses are using ScreenU. But first, let's start with just a really basic definition. We talk about SBIRT, and what exactly does that mean? Well, SBIRT is referring to screening, brief intervention, and referral to treatment. And so those are the three major steps of SBIRT. Before we go any further, just kind of knowing that screening, brief intervention, referral to treatment is SBIRT, I want to get a better sense of how many of you are doing some kind of SBIRT on your campus. So I'm going to ask you a poll question. I'm going to launch it right now for you. So I'd love for you to respond. Is your campus currently implementing SBIRT? And that can be SBIRT in any form or fashion, whether that's happening in person or using ScreenU on your campus. And so if you could let us know, yes, no, or maybe you're just not sure if SBIRT's happening on your campus, that's okay too. We'll just give you another second to finish voting. Excellent. Well, I'm going to share these results with you. This is really great. So we have 64% of people have indicated that, yes, SBIRT is happening on your campus, and that's fantastic. It's really exciting to hear that so many of you, a majority of you, are including SBIRT as part of your prevention plan, because as I mentioned, the Higher Education Center, regardless of how you implement SBIRT, believes it is really a key piece of a comprehensive prevention strategy on your campus. So we hope that when you walk away today that you have a better sense of what SBIRT is, the benefits of it, and ways that you can implement it on your campus. Okay, so we've defined SBIRT. Well, what is the benefit? Why should we be implementing SBIRT? And SBIRT has been shown to reduce a number of factors that can lead to negative consequences as it relates to substance misuse, particularly around alcohol. So the body of research around SBIRT's use to address alcohol misuse is much more substantial than other substances. However, research suggests that there are benefits to utilizing SBIRT, and of course, particularly screening with lots of substances beyond just alcohol. But SBIRT has been shown to reduce the typical blood alcohol content and peak BAC in college students, as well as reducing the peak number of drinks each time a college student is drinking, and the average number of drinks per week, as well as the number of drunk episodes a student experiences each week. And as I mentioned, although the body of research is not as substantial for other substances, there are studies that suggest that the use of SBIRT has been shown to lead to an overall reduction in substance misuse, including marijuana frequency. A recent meta-analysis of 185 studies found that the beneficial outcomes partnered with the savings and resources from implementing brief alcohol interventions and screenings with adolescents and young adults make SBIRT a worthwhile prevention strategy. So that's really important for us to remember. And SBIRT isn't done solely with college students. It's a strategy that has been shown to be effective with students from high school age all the way up to the general population of adults. And one of the things that the center was really interested in was the studies that show that web-based or computerized screening and brief interventions can be as effective as in-person SBIRT. And so that is one of the pieces that really led to the development of ScreenU. The use of SBIRT as part of your prevention strategy is supported by a number of organizations, including the World Health Organization, SAMHSA, which is the Substance Abuse and Mental Health Services Administration here at the federal level, the American Medical Association, and the U.S. Preventive Services Task Force. And let's see, about a year ago in November, the President's Commission on Combating Drug Addiction and the Opioid Crisis put out their final report and recommendations around how we can address the opioid crisis here in our country, and SBIRT was a key component of that report. In fact, it also identified ScreenU as a strategy to implement as we look at addressing substance misuse on our college campuses. So what are some of those key components of SBIRT? Well, one of the big things with SBIRT that makes it really appealing to everyone is the fact that it's brief. It takes very little time to be able to implement it, and the initial screening should be accomplished very quickly, between 5 to 10 minutes, and the interventions that come after that are shorter than standard interventions have been in the past. They are completed in significantly less time than traditional substance misuse specialty care. One of the other things that makes this unique, but is also truly a key component of SBIRT, is the fact that it's universal. So the idea behind SBIRT is that we screen an entire population of people. So as I've kind of mentioned, SBIRT has historically been done in person in medical settings, like in emergency departments, in trauma rooms. We see more primary care practices implementing SBIRT. And the idea is then we screen everyone who walks in the door at that emergency department, or all of our patients that are seeking primary care services, not just those that we are concerned about or think maybe they may have a substance use disorder. And that's true as we look at implementing SBIRT on college campuses as well. We should look at implementing it in a universal way. Perhaps we screen all of our students on a regular basis. Maybe that's annually. We screen all of our first-year students. We screen all of our students who walk into student health, or we screen all of our students of subpopulations that we may be focusing on. So having that universal component is really important. SBIRT also occurs in non-substance use disorder treatment settings. So it is not intended to be a way to treat substance use disorders. It's intended to identify people who are at high risk of developing a substance use disorder. And so it's best implemented in places that are not treatment settings, such as those healthcare settings and on college campuses. It also utilizes motivational interviewing, which is a strategy that facilitates conversations that helps show a discrepancy between a person's goal or values and their behavior through non-judgmental communication and reflective listening. And it's probably pretty likely that many of you are trained in motivational interviewing, or you're implementing strategies on your campus already that utilize motivational interviewing, things like basics. If that's something that's happening on your campus, motivational interviewing is a cornerstone of the basics program. And, one of the reasons why SBIRT is not typically done in treatment settings is because it's really focused on that population that is at risky use versus that population who has already developed a substance use disorder. And so, the vast majority of people in our country, in the world, and also on our college campuses are consuming substances in a low risk way. So that includes folks who are abstaining completely from a substance or are following guidelines that we've identified as as being low risk. A smaller portion of those people are consuming in ways that are risky, that are leading to negative consequences and harm. And then an even smaller portion of people, it's estimated between 3 and 5% of people have a substance use disorder. And SBIRT has been shown to be most effective with those folks that are screening at a risky use level, not folks who have already been diagnosed with a substance use disorder. So what happens when a person comes to maybe a primary care setting or walks in the door somewhere where traditional SBIRT is happening? Well, initially it starts with a screening. And so a person may start with even something as simple as a 1-question pre-screen to something more significant. And we're going to look at a few screening examples here in a moment. But based on those responses, we'll determine what happens next. So if a person screens at a low risk way, then the person who is implementing this will reinforce the positive behavior. But if they screen at a higher risk way, that might lead to a brief intervention or even a referral to treatment to another organization. And so there's lots of screening options that are out there, and we're going to explore just briefly a few of those screening options. All of them that I'm showing you, though, are open source screenings. They're free to use. And so I encourage you to learn more about these screening tools and consider how you might be able to incorporate them into some of the prevention work that you're doing. And the first that we're looking at here is the audit, the Alcohol Use Disorders Identification Test. And this is actually the screening tool that has been incorporated into ScreenU alcohol. And so you're looking here at the screening questions that we ask when a student completes ScreenU alcohol, as well as the scoring mechanism. So it asks the question and then provides a score between 0 and 4 based on their responses. And you add all those scores up, and that will determine their risk levels. So students who score between 0 and 7 are considered low risk, 8 to 15 risky or hazardous, all the way up to people who score above 20, which is considered high risk or likely dependent. The audit was developed by the World Health Organization, and again, there probably is the most a very significant body of research around the use of the audit, and it is a validated screening tool. Another commonly used tool, in part because it is so brief, it's only 4 questions, is the CAGE questionnaire. And so the CAGE is really focusing on if a person feels like they should cut down on their drinking, if people have annoyed you by criticizing your drinking, if you've ever felt guilty about your drinking, and if you've ever needed a drink to get started in the day or get rid of a hangover. And they call that the eye opener, which is where the E comes from in CAGE. And so 4 quick questions that you can ask our students, and if a student responds with a 2, that is considered clinically significant and worth an assessment. One of the things that I think is interesting about the CAGE is that it can be used in that clinical setting using very informal phrasing. So the questions can be adjusted a little bit to match the language of students. But it's also been found that it's most effective when it's part of a general health history. And most interestingly, it should not be preceded by questions about how much or how frequently a student is consuming alcohol. So it really is important to kind of stick to these 4 questions versus adding some additional questions that look at quantity and frequency of use. Additionally, the CAGE aid incorporates these same kinds of questions, but is adding illicit drug use or prescription drug misuse into the mix. And so if you're looking for a screening tool that looks beyond just alcohol, the CAGE aid might be for you. A score of 1 or more is considered a positive screen for the CAGE aid. The NIDA Modified Assist is also a screening tool that has been validated for use with young adults. It starts with a quick screen, and as you can see, it too looks at multiple substances in one screening tool. It is much lengthier than the other screenings that we've looked at for people who may screen positive in this initial quick screen. So if a student were to say no to everything, then of course the screening is complete. if they say yes to one or more days of heavy drinking, that's a positive screen for high-risk drinking. Yes to tobacco products is a positive screen for tobacco products and their support for, and we encourage smoking cessation resources. And then a yes for prescription drugs for non-medical reasons or illegal drugs then leads to a much more comprehensive screening that's asking about frequency and consequence of use, and it actually breaks down those illegal drugs and asks by category. So it asks about cannabis use, it asks about stimulant misuse, it asks about methamphetamines, for example. And so it really looks specifically at a large number of illicit drugs. And then the last screening that I'm going to share with you today is the QDIR, which is the Cannabis Use Disorder Identification Test Revised. This is the tool that we use for ScreenU marijuana, and it is similar in setup as the audit. A score of 8 or more is considered hazardous cannabis use, and a score of 12 or more indicates a possible cannabis use disorder. And ScreenU follows that same scoring mechanism as I just shared with you. So, as I've shared a couple of times now, the center really supports in-person SBIRT, and if it's possible to utilize that strategy on your campus, that's fantastic. We also know that it can be really challenging to implement in-person SBIRT, and even though it is less resource intensive than some other strategies that can be implemented, it still takes resources, right? And for many of us on campuses, resources are limited. In-person SBIRT requires training. So as I shared, it is done typically by a clinician that has been trained in motivational interviewing. And so that takes time to get your clinicians trained so that they can have these conversations. And because of that, it can be time intensive. It happens in a one-on-one situation. So there's time in thinking through how to make that work in the flow of your work day, as well as the time that it takes to get everyone trained. And then because of those reasons, it can be really hard to implement on a large scale. And, some college campuses, we're sitting here at Ohio State, that's a pretty large scale. And so the center, when it was initially started here at Ohio State and was funded by the Hilton Foundation, one of its goals was to think through how could we get SBIRT into the hands of more people, and how could we do that in a way that recognizing the limited resources that folks like you have on your campus to implement prevention strategies that are effective. And that is how ScreenU came to fruition. And so ScreenU is an electronic screening tool that identifies students who are at risk for alcohol or prescription drug misuse, as well as marijuana misuse. And so some of the benefits of ScreenU is that it is web-based. So students can take it on any web-enabled device. They don't need to download anything, so they can take it on their laptop, but they can also take it on their phone or their tablet. It's anonymous. We don't collect any personally identifiable information as part of that screen. It's brief. Most students complete it in under 10 minutes, and it doesn't require any training to implement. So I think, as I shared, we'll be looking at some of the data that we collected as part of an implementation study. And one of the things that we learned when we asked questions about, well, what kind of training did you provide people who were implementing campaigns? The answer was very, very little. And so we work hard to make sure that you have the tools that you need to be able to implement it, and are glad that it doesn't take a lot of resources to get your program up and running. ScreenU also connects students with vital resources on your campus. And so the thing that students walk away from is a list of resources that are local to your campus and community that you populate for your students. And so all of them, regardless of their risk level, will walk away with those resources at the end of ScreenU. It also includes real-time reporting, and Logan is going to share with you more about what the reporting features look like. There's some options for customizable elements within it, so you have the ability to customize a welcome and thank you message that goes out to students. And we have programs that are specific for alcohol, marijuana, and prescription drugs. The way ScreenU works is very similar to the way in-person SBIRT works. It's just digital. And so it starts with a welcome message that's customizable by you. We screen students depending on their risk level. They receive feedback. And students who are at a risk level above low risk move through some open-ended questions to simulate the motivational interviewing process, and then are connected with strategies to reduce their risk, as well as resources on your campus and within your community. And with that, I'm going to turn things over to Logan, and he's going to begin by walking you through the student experience.
Awesome. Thanks so much, Cindy. As Cindy said, my name is Logan Davis. I'm the Outreach and Engagement Manager at the Higher Education Center. It's a relatively new role for the center and for myself, and so I'm excited to dive in with you all and to talk a little bit about ScreenU. And so we'll go through and we'll begin with the student experience from ScreenU. When a student first starts taking ScreenU, this is going to be the first page that they see, the welcome page, welcoming them to the program, and the context or the text that you see here is 100% customizable. So this is the boilerplate message that we'll see when we go into what it looks like to create the program customizable to your campus, and you'll see that it's 100% customizable. Everything here is already there as a default message, but we have the opportunity and the availability to edit that to best meet your needs. And the questions that you see here at the bottom are the only demographic data that we collect. So first we have our gender question and all the options that we have there. Then we have class rank, the options all the way from first year undergraduate to graduate doctoral student, and then their age. And then that is the only demographic data that we do collect. So that is how we are able to keep it 100% anonymous and don't collect anything else. And we begin with our very first question. It's our gateway question. And so we figure out where they go and how they navigate through the program. And so as we begin with the question, have they had at least one alcoholic drink in the past 12 months? The other two programs will just talk about use of that substance. And so based on their responses, whether it's yes, no, or they're in recovery. So if it's yes, they'll continue to move through the screening, and then they'll go through the other parts of it as well. If they do no, they'll get some positive reinforcement for that and get some information that they can use for themselves or for their peers. And if they're in recovery, they'll get a specific page that will walk through that as well. And so this is the specific, so if they identify that they have been in recovery, so that they can get some positive reinforcement with that, but also be connected with recovery resources that might be on campus. And also thinking from a data perspective, if someone indicates they're in recovery, realizing that use of this program, you get real-time data. So as students report that they're in recovery, you'll be able to see how many students are reporting that. So it'll be a good reporting mechanism for you to have, so you can say, to your superiors or to whoever who wants the data or needs the data, you can say this is how many students that we have in recovery, so you can know how to engage the students that you have in recovery, but also can engage the students who are in recovery within those resources. And we'll talk at the end is how we edit and upload those resources and what is ideal on who to put in there. Maybe there's not a recovery community, but maybe we have someone who could be a recovery ally that students in recovery could talk to when needed. So as they go through the screening, this is what the questions are going to look like. This is what a traditional computer setting is going to look like. And then the mobile setting is going to be very similar. So the same exact question, just a little bit different layout based on the device that is being used. And so these are the questions that are walked through there. So based on the screening, it's a different number of questions, but they all look and are very similar to this setup here. So after the screening is completed, they land on this page. And so this page is customizable, or not customizable, it depends on, varies on their responses. So not everyone is going to get a boilerplate or the same response. So based on their risk level, where it goes moderate all the way to severely risky, that is going to vary based on their responses. So it's going to be tailored to their need and to their risk level. So this is just another example, kind of the rest of that page that would be on their web page right after they finish the screening, get information about their risk level and about the types of drinking they may be experiencing. And then it goes in to the brief intervention using motivational interviewing questions. And so this is one of the first questions that they will see. They will experience 2 to 3 open-ended questions here, getting them to think about their use and how it impacts them and how it impacts the people around them, really using evoking change questions. So getting them to think about whether whether or not they want to make a change, and what that change would look like, trying to get them to think about change behavior and emulate some of that change talk. And then it goes into readiness for change. So a readiness for change scale and readiness for change question. So getting them to think about on a scale of 1 to 10 what it would be, and then getting them to think about that in open-ended terms. And so it's going to ask them why it is important to them, how confident they are, and then how ready they are to make a change. And so it's going to ask them all three of those in that intervention session there. And then once they complete the brief intervention, they will be directed to resources. And we are focusing specifically on alcohol, but at the end, we're going to give you a link that you can take a demonstration screening of all three programs. So we'll give you the ones for alcohol, marijuana, and prescription drugs. So you'll be able to walk through all of those in a demo and see what the student would see on the student-facing side of the program. But this is what pops up specifically on the alcohol resources, and it shows what is available to them, and so the resources that they can kind of click through and see what is available in their community and on their campus. And as a reminder, these are 100% customizable by you to make sure that they match what is available on your campus. And in addition to the customizable resources, just some information that they can receive, some just very good information for them to keep in mind as they continue to engage with the substance, or maybe they're trying to decrease their use. So it's just things to help their relationship with the substance will be in their resources as well. And then again, some information, especially for, again, the tailored to their use. And so for the very risky use, the high risk is going to receive information about dependence and about recovery and what it would look like to stop, and just some resources they can have on campus.
Yeah, I think this is a really important piece here around supporting our students that are in recovery. And so that's obviously an important factor here at the center as to how we can support our students in recovery. And this is a way that even if your campus doesn't have a collegiate recovery program, you too can be a recovery ally and support those students and make them aware of the support groups and other resources that are available on your campus and within your community. And so we encourage all of our campuses to identify someone who is considered a recovery ally on your campus. And oftentimes that's probably you who are listening to this webinar, but it might not be. It might be someone else in your office, or it might be a faculty member who is familiar with recovery supports. It could be anyone on your campus, but we encourage you to identify someone to include here. And it's also a great place to highlight and bring awareness to your collegiate recovery program if you do have one on your campus. And so that's another great way to use ScreenU, is to make sure that students are aware of those recovery supports that are available on your campus and within your community.
Absolutely. I think it's a great way to just continue to highlight that, knowing that if students are going to be making that change, that it's going to be very difficult for any age, but we know as college age students making a big life change like that, the more support they can have, the better in that. So I think it's a great opportunity for that. And as we wrap up the student experience, we'll see just the landing page at the end. And so again, the text there, the very small text, is 100% customizable. So any information that you want to send, you can put it there, and it's customizable by campaign. So if there's specific things that you want to tell to specific audiences, so whether it is, we'll talk more about campaigns in just a moment, but if you want to do a different campaign per athletics team, or a different campaign per fraternity or sorority chapter, you have the ability to make that customizable per campaign there. And just two additional things here you see at the bottom. So those resources, they can download those resources, and it does list their risk level on that when they download the resources. So it lists their risk level, and then along with the resources, so it has all of that there, so they can see everything that is happening that has been recommended to them, as well as what their risk level was, and a certificate of completion if they do need to show that. So it is available there for them to download that, so they can show that they've completed it. So wrapping up the student experience, then we move into what the admin experience look like. So if you were to set up an account as a campus admin, this would be the page that you would see upon logging in. So this would be your main dashboard. And so you would see all of the data that is there at first, and I'll walk you through that. So that green data that you see is your data. So when you first begin, it's going to show zeros because we're not going to have anyone who's taken the screening yet. But as more people take the screening, you'll see the data reflect your campus. And then the national data is everyone that has taken ScreenU. It is not necessarily generalizable to specific populations because we know every campus is using ScreenU differently. But this is just so you can kind of see national data for every single person using ScreenU. So it's just ScreenU users for that specific program. So this one is alcohol. And so we also want to highlight as we look at the admin, and so we'll see the menu bar kind of on the left-hand screen, and then we'll also pop up in the right-hand screen where you can update your account information. So if you need to change anything in that, that is where you do that in the My Account section in the top right-hand corner. So as we continue walking through the admin experience, we'll first think about what it looks like to manage a campus. So you have the ability in ScreenU to add departments. And so what that does is that is able to get more people involved. And when we're thinking about campaigns, if a campaign is assigned to a department, only people in that department can access that campaign. And it really helps diffuse responsibility so everyone can be involved and we can work together on that. And so when we look at departments, we can see you can add different departments. So whether that's athletics, fraternity, sorority life, student wellness, the counseling office, you can add those there, and then you can add users to that department, and you can add users to there and then assign a user to a department. So when we're looking at creating a campaign, and then so you'll see there, you'll name the campaign, then you'll choose which program it is, whether it's alcohol, prescription drug, or marijuana, and then you'll assign it a department, knowing that once it's assigned to a department, only people in that department can access that campaign. And so you have the ability to if you want to have a specific date range, so if you want it to start, let's say April 1st, and we'll go all the way until the end of May. Or if you just want to keep it open, you can choose an end date that's way in the future, 2030, and then so that way there is no end in sight, so students can continually access the program and take the screening. And when you create a campaign, it's going to walk you through 5 different steps. And so the second step is going to be that welcome message that we saw on the student side of the facing of the program, and this will allow you to edit that. So when you create the campaign, the second step is going to be to edit that welcome message, and so 100% customizable to what you need and what you need to add in here. The second step, or the third step, excuse me, is what it's going to pop up as is how to send it to directly to someone's email. But what it is so this is a good way to highlight the various ways that you can implement ScreenU and how you can send the link out and send the screening out to the student. So this is one of the ways you can do that. You can send an email to a specific student. So if Logan Davis was an undergraduate student at your institution and you had his email address, you could put it in there, and I would get an email that says, "Hello, Logan. Thank you. You've been identified as a student that needs to take ScreenU." Would have the email in there, would have a specific link for me to take ScreenU. So if I were to click on that link, complete the screening, then you as the campus admin would be able to go into the campaign and see that I had completed the program. If Cindy was also a student in that, but she was not as good of a student and did not click on there, you'd be able to see that she had not completed the program. So you'd be able to track who did and who did not complete the program, and we look at what the data side, then we'll show overall how many students had and hadn't based on the targeted people that you had sent to do the program. And that is anonymous. So you don't see any of their data. All you see is that they've completed the program. That is great to point out, especially when people on campus are worried about data. So by putting in their email, all that you can see is completion. There's no way to track the data. There's no ID, none of that. The email is never tied to the data, only completion of the program. And so that is just one way. So another way to do it is you just send them the link via email, and it's not a link specific to them. So you don't necessarily see that they've completed it, but then they get access to it, and then you see the students complete it, but you don't know specifically who has completed it. And then you can have a link where you can put it on TVs, maybe on campus, on screens. You can put it on flyers, and just send it out that way. So it's there's various ways that we've seen campuses send out the link, but the one that's going to pop up in step 3 is the way to send out automated emails where it's specific to the student, and you'll be able to see only if they've completed the program. And so step 4 is going to follow that. So it's be a way for you to upload all of those emails. If you have, let's say if you work in an athletics team, you have a roster of all of your students on your team, have your email. So all you would do is you would click on that green link there where it says click here. That is a CSV template file. So all you would do is open that, delete the examples, and you would upload those students there, upload their emails, save it as that CSV file. You don't want to transfer it to an Excel file, and then upload it, and then it's going to automatically put them in the system, and when you send it, it's going to send them that customized email that you just created. And then the landing page, so when you see everything that you've created, kind of reviewing your campaign, you'll see everything you created. You'll see the students that you added manually or using that CSV file on the right-hand side. You'll see the dates that you inputted. And one thing that I do want to mention here is this demo URL, which is a great opportunity to share with people on campus what students are going to be experiencing. And so this demo URL does not collect any data, but it's going to show all of those customized messages that you created. So it's going to be the exact experience as the link below, except it doesn't collect any of the data. So it's a great opportunity to share with administrators or other campus partners exactly what the students are going to be experiencing without collecting any data. And it's important to point out, after you've created a campaign, it's not like everything is set in stone. You have the ability to go back and edit things as you go. So if you realized you want to edit the welcome message a little bit, you have the ability to do all of that here. And then so you can edit all of that using these 4 links. And this is at the bottom of that campaign page. So every campaign page, these are there at the bottom, and you have the opportunity to edit those. Also in the admin experience is campus resources, which we talked a little bit about, and we showed you what it looks like on the student side of things. And so here's what it looks like on the admin side and the 4 key areas of campus resources. And so this is what it would look like where you would add those resources. And once you add a resource, this is what it looks like there. So all of the information that is there, linked to that specific resource if they have a landing page for that, or if they have a website, and then how to get in contact with those people, and then how to edit them if things change after they've been added. So one of the last things we want to touch on the admin side is data. And then so how do we get a report of our data? And so we're going to start here. You click on the program that you want to look at, whether it's alcohol, prescription drug, or marijuana. If you want to look at a specific date range, it could be if you want to look at maybe last year, if you just want to look at the last month, 3 months, however you want to do that. Or if you just want to look at total campus usage, you would just go ahead and put see report. But if you want to customize it, you would input your data there. Once you input the data, the first thing that you are going to see is the number of screenings over time. So it's the total number of participants that have taken the screening. And it's going to show you up and down ticks of the screening, how many students are taking it at a specific time. Next, you're going to see kind of overall risk level, kind of an overall overview, if you will. And I mentioned there that green and blue pie is going to be the students that were specifically identified, how many have completed it, how many have not completed it, and then you're going to get your overall risk level. So if we look at the very colorful piece of pie on the right, and then so if you click on a pie piece, it's going to break it in and look at demographic data. And then so it's going to look at each piece, and it's going to show you demographic, much like on this next one. And so this is question 1, but it's going to show you the demographic data that is at the bottom. You can do that on the pie piece above for overall risk. And then as you go through each question, you have the ability to update that as well, or to click on that and get information on the demographics for each question. And so I'm going to hand it over to Cindy, and we're going to talk about kind of the more broad overall, what does ScreenU look like using it on a campus?
Well, thank you, Logan, for walking us through both the student and the admin experiences for ScreenU. As Logan mentioned, we'll be providing you with some demo links because although it's nice to look at the screenshots, I'm sure all of you are interested in really diving in and seeing ScreenU and how it might work when you're actually putting in responses. And so at the end of this, you'll see some links that will get you connected with the student experience for all three of our programs, ScreenU Alcohol, ScreenU RX, and ScreenU Marijuana. And we'll also be including those in a follow-up email to you as well. So we encourage you to dive in and explore them. This past fall, we were able to complete a small study around how campuses are using ScreenU by surveying and interviewing some of our campus members to get a better sense of where they're implementing it and what the steps were to actually get from the place of having this tool and just having access to actually collecting screens from students. And so we're going to share a little bit about the data that we collected through that, as well as some tips for implementing and different settings that we've learned along the way as part of that study and through the implementation, talking with other campuses who have been implementing ScreenU, and then we'll wrap up with some questions. And so first, I just want to share a little bit about what campuses have been sharing with us about ScreenU and some of the reasons why they like using the tool. And one is the ability to reach a broad audience. And really, that's the whole point of SBIRT, is to implement in a universal way. ScreenU makes it easier. I know there's more than one of you that is listening that is prevention is one small piece of the work that you're doing, and you might be the only person on your campus who's actually designated to do prevention work. And so your time is valuable. Here's a way to reach lots of students with a very limited amount of time. One of the other things that people like is it's the easy to access data. You have the reporting that is in real time that you can view on the dashboard, and it gives you access to important data that can inform prevention efforts and the direction of your prevention efforts for your campus. And it's also really easy to involve multiple departments on campus. And that's important because the work that you're doing is only as strong as the partnerships that you have on campus. And so if we can find opportunities to collaborate with other units on campus, we'll be able to do stronger prevention work. And so if a campus is interested in ScreenU, the question often is, well, where do I start? And our goal here at the center is to make it really easy for you, as easy as possible. And through our study, we were able to identify a few steps that were really crucial for the campuses that were successful in implementing ScreenU. They all followed these steps. One was to identify a champion for ScreenU. And that champion may be you, and oftentimes it was the person that we were talking to, the person who is the director or assistant director in health promotion or wellness office, or the health educator on campus. They were the person that really served as the champion for ScreenU. Other times, that might have been the person who brought ScreenU to the attention of others who then had a little bit more leverage on campus to really bring it there, and had the ear of administrators or the people who needed to get the buy-in to be able to implement ScreenU. And so having someone who is a champion of ScreenU, whether that is you or someone else on your campus, I imagine you know who those people are that need to be on board to do something like this, and identifying who that person is really step one. Identifying potential partners is also really important because one of the things that we learned is the majority of campuses are using ScreenU in their wellness office, which isn't really surprising because they're the ones that are leading the way. But having other partners allows you to expand your reach on campus and screen more students. So think through who those partners might be on your campus that are crucial to implementing ScreenU with the populations that you're interested in focusing on. And then another key piece is gaining that buy-in. And so some of the things that came up in our conversations with our members when we asked, well, how did you gain buy-in, was really highlighting the benefits and providing those demonstration links to people. And so talking about that it's anonymous, that it's brief, that it happens on a student's phone or a tablet, those are all benefits to ScreenU, that there's a brief intervention that's incorporated within it. It's a way to reach lots of students and connect them with resources on your campus. Those are all benefits that campuses have shared with us or things that they like about ScreenU. So highlighting those and then providing them with the demonstration links that we're going to share with you is also key to gaining buy-in. And one of the things that we're happy to do with campuses is a live demonstration. And I was looking through those of you that are joining us today. I know we've done some of that with a few of you on our call today, and we're happy to do that with others. We can do that with just you, or sometimes what's most helpful is to get a room full of those key partners, those stakeholders on your campus, and we can do a demo for all of you, provide them with an opportunity to ask questions, and they can get their questions answered about ScreenU and how it can complement the prevention efforts that are currently happening on your campus. So another common question that we get is, well, where is ScreenU happening on campus? What departments on campus are using ScreenU? And so over half of the campuses that we surveyed are implementing ScreenU in more than one place, with wellness being the most common place. And that's not surprising, as it is the place where oftentimes we have the most control if you are coming here, if you're listening to this webinar as a wellness professional. But we also recorded 10 different departments who are either spearheading or are active partners in the implementation of ScreenU among those campuses. And we also have departments who are utilizing ScreenU, but in a variety of settings. And so it might be that the wellness office is incorporating ScreenU into all of their wellness presentations, or they're working with academic advisors to incorporate it there. We have a lot of campuses who work with the athletic department to implement it within athletic orientation or new student orientation, or as a risk management tool with fraternity and sorority life as part of their standards presentations. So ScreenU is being used in a large variety of ways on campus, and it's always interesting to learn more and more about the unique ways that campuses have found to be able to incorporate it into the programming that they're doing. So I'm going to just spend the last bit of our time kind of looking at some of these departments and how campuses may have been implementing it or leveraging the connections that they have with those departments to be able to move ScreenU forward on their campus. And again, wellness was the primary champion for ScreenU on the vast majority of the campuses that we spoke with. I don't know that that's a surprise there. And so they were implementing it oftentimes not just in one place, but in lots of places. So when we talk to campuses who were using it in their wellness, it was not just, well, we're doing it in our wellness presentations. It was, we're incorporating it into all of our wellness presentations, and we've hyperlinked it on our website, and we're doing it with tabling events, and we're doing social media around it. And so those of you who are implementing in that way are finding lots of ways to implement ScreenU in the work that you're currently doing, not just in making more work for you to do. So finding ways that it can really complement your current prevention efforts is really key. So here are some of the strategies that campuses shared with us. We had a lot of success around just incorporating ScreenU into the typical presentations that your wellness staff might be going out and doing, or when they are requested to do a presentation with fraternity and sorority life or with athletics as part of that athletic orientation. Although we're working with the athletic department, it was often being spearheaded by the Wellness and Health Promotion Office. So I encourage you to think through all the ways that you're already working with folks on your campus and the different prevention strategies that you're already implementing, and is there a way to incorporate ScreenU into those? When it comes to athletics, one of the things that we learned was gaining athletic department and coach buy-in was key. So it was not happening with an athletic department unless they were fully on board with it. And so in addition to that, the athletic department really drove the implementation strategy. And so the conversations we had with campuses who are implementing with athletics indicated that through the meetings that they had around implementing this, it was really up to the athletic department to determine how. And then the wellness and health promotion staff, or the champion of ScreenU who was working with them, really then gave them some guidance on best practices around screening. Like sometimes we have to remind people that universal screening really is key, rather than screening just our students who we're concerned about. So they provided that guidance there, as well as some logistical guidance. And then we found that in all cases, it was the professional out of wellness and health promotion, or the professional that brought the program to campus. They were the ones that really did the work. And I put work in quotations because the work is really minimal, but they were the ones that set up the campaigns. They provided those campaign links to the athletic department or to the coaches to distribute with students. So they were the ones that had to kind of tie up all the loose ends and keep the wheels on the bus to keep it moving, rather than just providing a colleague in the athletic department with access to ScreenU to do that on their own. So we found that that wasn't as effective as keeping that ownership in-house and then just kind of doing those steps for them. In conduct settings, we have a number of campuses who are using ScreenU to triage students, in a sense, to be able to identify what kind of sanction fits not just their offense, but also meets their needs. So if we have a standard sanctioning process and we have a student who maybe has a relatively minor offense but screens at a really high risk way, it could be that going to a short educational course is standard, but are we really meeting our students' needs if it shows that maybe there is a legitimate concern about a substance use disorder there? And so this can help identify that and provide opportunities to then connect those students with the support and the resources that they might need. It's most often done in advance of meeting with a conduct officer, or we also had a lot of campuses who incorporated ScreenU in the conduct sanction, but they were the ones that were executing the sanction. So for example, wellness professionals who are executing basics with students or are executing another educational program that's part of a sanction, they incorporated ScreenU on their end versus through the conduct officer. Screening links for some of those campuses were included in letters or sent through the identified student email so they could track completion. And then conduct officers can use that resource page to help determine risk levels and make recommendations as well. Of course, in a clinical setting like a student health service or a counseling center, it can be implemented in a waiting room. You can use a community tablet or a student's device. They can take it on their own device if you want by just providing a short link to the screening so that they can do that on their own cell phone. And those conversations can happen still with providers if you choose, by having a student opt to self-disclose their risk level, or they can share the email that Logan referenced about that last resources page has an indication about their risk level there that they can use to guide those conversations. And so I just wanted to kind of wrap up by sharing a little bit about some of the things that we heard from member campuses that we thought were really positive. And so some of the themes around that were that ScreenU helps them work more efficiently. And so campuses have replaced paper-based systems for screening, which saves a lot of time. And so they found that ScreenU was really an efficient way to be able to screen lots of people with limited resources. The student response about ScreenU has been overall really positive, even when participation is optional. And so we talked to a number of campuses that they get the bulk of their their screenings each year through just presentations that they're doing, and so that's optional for students to complete. They put the screening link up there either while they're waiting for everyone to gather so that they can get started, or at the end of their presentation, and so those optional opportunities for students to participate have been really well received, and the response has been positive. And then, of course, the other thing that people like is just the access to data. We know data drives a lot of the work that we're doing, and so here is a way to have some of that data that can be used to inform your prevention practices moving forward. And so I do want to just mention, hopefully we got you really excited about ScreenU and the ways you can use it on your campus. And if this sounds like something that might be a good fit for you in the current work that you're doing, we encourage you to reach out to us to learn more about membership benefits to the center, which include unlimited access to all 3 ScreenU programs, as well as access to a number of our other resources, including our learning collaboratives, which are a series of web-based trainings around a specific topic. We've done a number of those on topics including cannabis, collegiate recovery, prescription drug misuse, and our most recent one was on engaging peers. It also includes a discount to the national meeting, which is coming up at the end of July. So here's those screening links that I mentioned to you. You're welcome to jot them down now if you'd like, but we will be posting a recording of this webinar as well as the slides on our website within a few days of us wrapping up today, and so you'll be able to grab those there. We'll also send those demo links to you via email so that you'll have access to them. So there's 3 links here, one for each program, so we encourage you to check them all out. We also, if you're interested, you can get a demo account, so access to that admin account that Logan walked you through by going to that last link, go.osu.edu/demo ScreenU. So what are our next steps and what are some resources? So here's a list of resources. If you're interested in SBIRT, regardless of what it is, as I shared before, we encourage you to think about how you can incorporate SBIRT into your programming that addresses substance misuse across the continuum. We think it's really valuable. And so here are some resources that can help support you, particularly around traditional in-person SBIRT. Our friends at IRETA are really fantastic. They put out a lot of content around SBIRT, and so I encourage you to check out some of their webinars and learn more about how you can implement SBIRT through them as well. But maybe you're also interested in, well, what are my next steps? I'm really interested in ScreenU specifically. And so here's those for you. If you feel like you're ready to maybe dive a little bit deeper into ScreenU or have specific questions answered about how you might be able to incorporate it into the work you're doing on campus, we encourage you to email us at screenu@osu.edu. If you're ready to move forward, the next step is to gather those key stakeholders on campus, and we can work with you to identify who those people might be. We also encourage you to audit the resources that are on your campus to ensure that you have identified everyone that might be great to get into the hands of students, both on campus and within your community, and create an implementation plan. And again, these are all things that we can help provide some support to you as you are working towards implementing ScreenU. Regardless, I just wanted to mention that National Alcohol Screening Day is coming up on April 11th, 2019, and so it's a great opportunity to connect with students and provide screening to them. The center believes that screening and brief intervention is really an essential component to a comprehensive prevention strategy. And so National Alcohol Screening Day is every year the Thursday of the first full week of April, and so it's a great opportunity to really promote screening among students. That is the end of our session. I think we have a few minutes for questions. I do want to do one final shout out about the national meeting. Be sure to mark your calendars for July 29th through August 1st. It's here on campus at Ohio State. It's an excellent conference. I know I'm a little biased, but I do think it's a great conference around looking at collegiate substance misuse across the continuum. So we welcome all of you who are working to address substance misuse, whether from prevention, intervention, or recovery, or maybe you're that person that wears the hats of all 3 of those. This is a great conference for you. The early bird discount ends April 26th. And with that, we're going to take some questions. Logan, do we have any?
Yes, thanks, Cindy. We have a few really good questions. And the first one that we want to talk about is, will students get a report that they can print out or make a PDF of the screening?
So students don't receive their specific score from the screening, and in part because without much context, that score doesn't mean a lot to students. So what they do receive, and I encourage you to take a demo so that you can see what that looks like. Logan shared a couple of the screenshots. Is they receive that last strategies for change and resource page. So depending on their risk level, we'll determine what that page looks like. But there is a all of them start with a paragraph around the student's risk level and indicating kind of where they should go from there. So those students that are at a high risk likely dependent, it really focuses on getting them connected with a healthcare professional for that referral to treatment piece. And so then we emphasize resources that are specific to that as well. And then, of course, it includes those strategies to help reduce their risk.
Fantastic. Thanks, Cindy. Our next question that we have is about conduct. And then they had a question about how it is used in conduct and where does they come in of the anonymous piece. And so, yes, I know you mentioned maybe them sharing with the conduct officer. If it's in a critical triage setting, they might be sharing. And so how does that anonymous piece go in with conduct?
That's a great question. So the tool is anonymous. It doesn't collect any personally identifiable data, which means that we don't have any of that personally identifiable data. Of course, the way you structure this is up to you in it. So it could be that it is done for a student to just know on their own, and then they can self-disclose. It could be that they are asked to share that resource page with the conduct officer, who then is able to see their risk level based on the text within it, but wouldn't necessarily have a student score. So they wouldn't know a student's specific responses to questions, but they would know that that student is at high risk, for example, or is at low risk. And so that's an option as well. We are happy to work with campuses who are interested in using it in this way to find a strategy that might meet their needs and fit their conduct process.
Awesome. Thanks so much for answering that, Cindy. The last question that we have time to get to today is similar to that, but it's with being anonymous, is what responsibility have campuses shown or had questions about students that are displaying high risk and then maybe might fall on the spectrum of suicidal ideation? And so what campuses, because they do have data of students that are in that high risk, so then how do they then handle, if we know we have students that are in this population, but it's an anonymous tool, how do we handle that?
That's another great question. So, because it's anonymous, you don't know a specific student. There isn't a liability in terms of failing to address an issue for a specific student. That's one of the things that we get feedback on, and it goes both ways, right? So for as many people who wish this tool wasn't anonymous and that we could identify that student, we have just as many and sometimes more people who appreciate the anonymity of it, because it can be challenging then to meet the needs. If you uncover a large number of needs, it can be challenging then for you to meet your needs and to then know exactly that you have Bob and Tim and Diane and these specific students who are really, really struggling. Then there is an obligation to reach out to those students and work with them. What this can do though is to let you know of trends. So if you start to see some trends like that, it gives you the ability to advocate for more resources around this issue by saying, look, this is an issue for our students, and I have some data to support that. One of the nice things about ScreenU is it provides not not just the reporting that Logan showed, but a full CSV of all of the screens that's been de-identified. So it doesn't have any of the demographic information, but you're able to follow a screen from start to finish and see their open-ended responses. So again, it's de-identified, so you can't tell who is responding, but you are able to see how they respond and those open-ended questions as well, open-ended responses as well. So I hope that answers your question. I know we're really excited to have been working with over 40 institutions so far across the country implementing ScreenU. And we'd love to help expand the use of SBIRT across the country, regardless of whether it is in-person SBIRT or with our tool. We think that ScreenU can be a really valuable tool for campuses who are strapped for resources, whether that's time or money, and want to reach lots of students. And one of the things, I know I'm over on time, but I'll leave you with this. The thing that I like ScreenU like most about ScreenU is that we do a great job of hitting students hard those first 6 weeks when they come on campus, and rightfully so, right? We have data to suggest that that's a crucial time for student success on campus. And then unless they get in trouble or are part of a high-risk population, we might not ever reach those students again with messaging around substance misuse and how to make low-risk choices. And so this is a quick and easy way to reach all of our students, regardless of whether they have gotten in trouble with alcohol or other drugs or are part of that high-risk population that may have slipped through the cracks and now are just turning 21 or 22, or even our graduate students who oftentimes we do very little with on campus. And so we think it fills a gap that might be existing on campuses when it comes to prevention. Well, I just want to thank everyone for joining us. I want to thank my co-presenter, Logan.
Thank you so much, Cindy. And the last piece on the questions, and so if you submitted a question and we did not get to it today, we will follow up with you individually. It tells us your name, and by registering, we will be able to find your email. So we will send you a response to your question individually if we did not get to it today. Thank you to everyone for submitting questions and for spending an hour with us this afternoon. We're very thankful that you did so. We're able to learn more about ScreenU in the Higher Education Center.